According to sessional order, member statements have precedence. Is any member seeking the call? Honourable Susan Carter.
Mr President, it is, I believe, a good practice in this place that when we introduce new schemes of legislation, we regularly require reviews and reports. This helps us to ascertain whether the legislation is working as intended or may require some change. And as it's become very clear to me as I move around the state, we are not the only people who read these reports. A number of people mention these reports and are eager to share their views. Of late, I've received a number of comments about the interim report of the VAD Board, set up to oversee the operation of the voluntary assisted dying laws in our state. This report provided data and an overview of the operation of the first 3 months of the euthanasia laws in New South Wales. And one stark figure has jumped out at all who have read this report. Over 2/3 of all the requests to die have come from regional New South Wales, where only 1/3 of our population live. Why? Why this disparity? The concern, of course, is that this represents hard statistical data which underlines the disparity of access to healthcare in our regions and a difficulty in accessing palliative care once you leave the city. This view is shared by Go Gently, who in their recent report on the state of euthanasia queries whether one reason for this disparity, 2/3 of requests to die from 1/3 of our population base, is because people living in regional areas have poorer health outcomes overall. They suggested that the lack of adequate health services and limited access to palliative care in the regions may be driving individuals towards voluntary assisted dying, the opposite of the choice that this legislation was designed to provide. Go Gently note, however, that there is no real information which tells us one way or the other whether this is true. So this surely raises an issue for investigation. Do our citizens in the regions have the same access to healthcare as those living in the cities? And if not, why not? It is unacceptable that geographical location should dictate the level of healthcare available to our citizens. And voluntary assisted dying is not and was never intended to be a convenient solution for a lack of support from either communities or our state healthcare system, a system which includes palliative care. The report suggests that when individuals in regional areas are faced with limited options for managing pain and suffering, they may feel compelled to choose VAD out of desperation rather than preference. This is not a choice that anyone should have to make. What is the point of generating reports if we do not listen to the messages which they give us and act on the problems which they disclose?